Welcome to Your Health Matters. I'm your host, Temesia Tuicaumia, and tonight we have Marau Kini, a projects manager for Diabetes Fiji, a non-government organization. Welcome to the show. Bula Vinaka.
Thank you so much. First of all, I just want to acknowledge the MaiTV for the invitations. We're able to come and just to share what the program is about.
Yes.
The organization is being focused on the functions, and also before we begin with our discussion, I wish to say and send greetings to all our viewers who join us this afternoon. On behalf of the organization Diabetes Fiji, I extend my sincere appreciations to the MaiTV as well for the opportunity to discuss one of the most pressing health challenge in Fiji. For diabetes, it is an honor to be part of this platform. I know this is a new platform for the MaiTV, and in terms just to give us an opportunity to raise awareness and share the insight and advocates for the stronger national actions against this growing epidemic.
Yes. Well, thank you so much for that introduction. I think the first question we really want to tackle here is understanding diabetes in Fiji. I know somebody, a family member, we have friends that have had diabetes or have fought through diabetes, but I think the pressing question is really, what is diabetes like in Fiji and how is our country doing with this?
Before I'll jump to respond to your questions, I wish to brief an overview what the statistics is about about diabetes in Fiji. So based on according to the latest World Health ranking, that Fiji has the unbeatable role for being related the country with the most number of deaths related to diabetes mellitus.
wow.
So with the presence of population approximately of 900,000, we've lost almost 1,700 people annually to this killer disease. So it's quite alarming, and it's the biggest contributors to our mortality rate in this country. So then the next highest contributors factors we can say a chronic heart disease with 1,454 deaths annually, stroke with 663 deaths annually, and kidney disease with 480 deaths annually. So needles to irritate this, all of these have a close to link with diabetes as well as comparisons. All to cancers combined result in over just 1,000 deaths in a year. So talking about diabetes is just a portions of when you're talking about NCD.
Right.
So some may wish to argue on the reliability of accuracy of this information, but we need to focus on the message that is coming loud and clear.
Right.
We need to change our eating habits and lifestyle to be a healthy nations. So if you're talking about the life expectancy to say 69.9 years of the average person here in Fiji, that doesn't compare favorable to our neighbors like other Pacific Island like Vanuatu, which is 72 years old, 72 years, Tonga with 73, Samoa with 74 years, and New Zealand with 81.6 years. While New Zealand may have the unfair comparison, this figure that we should be aspire to. But the comparison with Vanuatu, Tonga, and Samoa are more astounding as they have a similar communities and similar environment, eating habits, and the lifestyles as Fiji. So we must not note that a lot of these deaths are not advantage age, but we need diabetes-related death occurring in the 20s and 30s as well. So this combined with alarming of the high rate of amputation. So Fiji is well known with that, over 1,000 per year, to say approximately impact significant to our ability to contribute the advancements of our families and ultimately for our country. So we can see this, that the country has been invest so much on this, talking about diabetes complications. So the most relevant issues here in the message is that the diabetes can be controlled.
It can be.
But first we need to determine the number of pre-diabetics and diabetics in our country, and all those are high risk by developing this deadly disease. There are no statistics of pre-diabetes in Fiji to say, mainly because we do not get the screen to determine. The early screening that we usually encourage our general populations to come forward for them to be screened. So we are on the scale where we at the present. If this group can be identified as the pre-diabetics, we can make a huge difference and try to intervene early as much as we can, so to delay and stop the onset of diabetes
before it moves on to its later stages. You know, just for our viewers at home, you hear the norm of, you know, families saying, oh, my grandmother had it or my mother had it, so it's passed down in generations. But I think it'd be really cool to really, you know, cut to the chase about that. What's the main causes for diabetes, and are there different types of diabetes?
Yes, definitely. Certainly, we have different types of diabetes, well known medically, which is we have type 1, type 2, and gestational diabetes mellitus. So just to define more on the three types of diabetes. Unfortunately, back in most our rural communities, they still define there's only two types of diabetes. If I can translate into a Fijian vernacular, they used to say, matin sukai loma se matin sukai tumba. They are not aligning in themselves to the medical term, how they define the types of diabetes. So with type 1 diabetes, we define as an autoimmune conditions where the body attacks insulins. Insulin production cells, it often develops in a childhood. So with the youngest one, we have it.
Did you just say childhood?
Yeah.
Whoa.
Yeah. With the youngest one, we have it type 1 diabetes in Fiji with a 4-year-old.
4 years old.
Type 1
so diabetes is it targets anyone at any age?
Targets anyone, any age, doesn't discriminate about your race, about your age, or even your gender, whatsoever. So it's about either your lifestyle.
Or lifestyle.
So with the type 1, it's talking about the lack of insulin in their body. So mainly for young people, mainly it happens to young people. So for type 2, it defines there's a most common type where the body either resists to insulin or doesn't produce enough insulin. It's largely lifestyle related. It's like a lifestyle disease.
So lifestyle as well.
Yeah, there are other indications where for type 2 diabetes. Number one that we just alluded is it's a family history. So where we have from mom's side or father's side, if your grandparents or anyone from the, both of the two families have diabetes, so it's indications you might have diabetes if you're not control or prevent yourself from those kind of lifestyles. So
I think it's important for them to go into,
that's what
places like you that provide services to
That's
educate.
what we've been encouraging, our communities for them to, to reach out to the services that we provide around in our communities. Unfortunately, one of the biggest challenges with us that mainly for Itoke, we only visit hospital when we come to the complications.
That's right. So it's more of a reactive situation than it is proactive. Thank you. We'll take a quick break and we'll be right back on Your Health Matters.
This program is brought to you by the Ministry of Health and Medical Services, shaping Fiji's health.
Welcome back to Your Health Matters. We had a great start to our conversation about the types of diabetes that are out there, and we missed on the last one, which I think is very important for our viewers at home to know of. So can you please share that with us?
Thank you, Temesia. So we've been talking about this medically, the only in Fiji, it is known to be 3 types of diabetes. Compared to other developing countries, they are more detailed on like 5 or 6 types of diabetes. So while we had a discussion on the types of diabetes here in Fiji, so the third one I think we need to really stress more is about the gestational diabetes. Gestational diabetes mellitus, or the GDM in a short form, it occurs during a pregnancy. It's only for women.
Only for women.
For women during a pregnancy.
I see.
And the increase of the risk for both moms and the mothers and the babies that can develop to type 2 diabetes later in life if it's not controlled or being
Yes.
managed. So those are where we are with the organization, with our initiative for this year. We're trying to focus to target our women, and during pregnancy. In back in our communities where mothers usually, before delivery, they usually check their sugar as part of their routine health checkups. So they usually check their blood glucose in their health facilities. When they check these, sometimes they will, their sugar is usually high.
Okay.
So after delivery, then
Yes.
their sugar is no more, like it's going to normal. So these are the indications that are given to a mom that you might, if you're not controlling or if you can't manage your lifestyle in later on in life, you might develop type 2
Wow.
diabetes.
And it just doesn't affect the mom, it affects the baby as well.
Yes. So
I
that's
see.
that's why our advocacy with our awareness educational programs, we're trying to emphasize our mothers to take a heed, with the
Really building that
information.
awareness.
Yes,
eh?
yes.
Well, thank you so much for that. And now we know that there's 3 types. I think that really takes us to our next question is how do we actually prevent this in our communities? And what are, good food to be eating and food that we shouldn't be really including into our diet? So if you could share a little bit about that, Marau.
Thank you, Temesia. It's really simple to say. In other words, whatever we're talking about here in the media, for our listeners, it's sometimes we talk about it's quite simple and easy to say, but you put into action, that's the biggest
That's the challenge.
especially when we're talking about the lifestyle changes.
Yeah.
So simple but effective change, including the maintaining and a balance. That's a challenging thing. Not only, talking about people living with diabetes, that's the biggest challenge in terms of balanced diet. Engaging a regular physical activity. Managing stress. Mental health is a really important component for the strong role on that. And avoiding, for those who have been taking tobacco, alcohol, so we're always trying to emphasize this, they have to take in moderation in a way. Yeah? So talking about all this is something that, the indication that we can manage and prevent.
Right.
If you need our blood glucose need to be in a managing control in a level that is been advised by our medical professionals, they need to adhere to that advice. Otherwise, in times you might, these are complications. They will reach up to the complication and it's too late.
It's too late. I'm just so curious. How does a plate, a healthy meal look like for these communities? If we're trying to really tackle it and really speak out to our viewers and the children at home that are watching, what would a plate look like that is a balanced meal for these communities?
Well, most of our viewers, before we share more in detail on that, I do hope and I understand our students, brought up from primary school, they will be educated about the 3 types of food groups.
Right.
So talking about 3 types of food groups, and one of the challenges with us, it's not about the 3 types of food groups, but the portions, the amount.
The portions.
So that's really important. But for us, it's quite challenging. Because we usually, we love our food.
We do.
Yeah, we really do love our food. But the thing with us, we want to see our food has to be mountain in a way. But we're not talking about the 3 types of food groups, but more on starchy food.
Wow.
Yeah, so it's quite a challenge. So we encourage our viewers, mainly to our people living with diabetes, to visit their nearest health facilities, to consult with their nutrition. Dietitians are out there.
They're available.
They are available to be there.
So that's where they can go.
They can go there if they need a diet plan, to go whatever they do in terms of physical activity or whatever work they do, it has to be aligned together with the meal. While talking about the nutrition, but it's really important, the mental health component as well. So mental health is really important part mainly for people living with diabetes, because stress is one of the biggest contribution factor. Always gets their sugar high.
Yes.
Yeah? So we always encourage, especially our Itoke communities, when someone living with diabetes, the only thing that our diabetic people living with diabetes, they really need is the types of support.
Wow.
Yeah? So if we really have a good support from home, from our loved ones, I'm hoping that for sure that we can control.
Creating these safe spaces at home as well,
Yes.
for our communities.
Yeah.
Do you find it that there's not a lot of room for that. Well, mental health is just, an awakening space in Fiji. And a lot of people are now talking about it, and there needs to be more room about it. Do you see that in the work you're doing now? Is that becoming a normal space for communities, or is there still need to be a push that we need to recognize this?
Yes, this is still a need a push from our community, because one of the biggest challenges that even though we only have mental health available mainly in the urban areas,
Right.
or in the main hospital, but that's something that we need. We need these services to be decentralized down to our community level.
Even informal Talanoa sessions would do, right?
But one good thing Temesia can share is that most of our mental health centers around Fiji nowadays, they have provide a mobile services as well.
That's
where
very cool.
They have a toll-free.
Oh, that would be so cool to see.
We encouraging our communities, mainly people living with diabetes, to reach out, to utilize this kind of services, so they can have more talanoa and discussion. Yeah? So for us, when we work along with our partners, these are something we encourage our communities. They need to utilize the services that are readily available, so they can be informed with the right information. Sometimes one of the biggest challenges when we're reaching out to the communities, our clients are usually tend to say, I've been misinformed with the information that I received from their neighbors or the nearby community. But what we encourage them, they have to reach out to these specialists who are well trained, available, who can provide with those kind of support.
Well, thank you so much, Marau. I feel like I'm just learning so much from you. Starting our time together, you were talking about the youngest being 4 years old, and now we're talking about prevention, which is very key. And I think what's important that you've just shared was the importance of mental health and having these conversations. I hope you've been enjoying this time. We're going to take a little break, and we'll see you right after with Your Health Matters.
This program is brought to you by the Ministry of Health and Medical Services, shaping Fiji's health.
Welcome back to Your Health Matters. We've been diving into some really deep conversations about diabetes in Fiji, and we've talked about the misconceptions of how family and the rural communities really need to have more sessions, even here in the urban areas, on mental health, and I think that really struck something with me. We really wanted to dive in and really hear some of the experiences of people living with diabetes here in Fiji. What's it been like for you serving in this role for the last 10 years, as you mentioned?
Well, to me personally, Temesia, when I've been moving to my 10th year, I've been serving.
Congratulations.
Thank you.
It's a decade.
I've been what I found out is that while serving with this charitable organization, passion is one of the things that drive me through, and working along with people living with diabetes, mainly for young people.
Yes,
it's quite we have an emotional when we have engaging ourselves to be involved with them. Where parents are not yet to be educated
about
these conditions of diabetes. So as families, it's play a really important role. When you're talking about diabetes, well, like I think we've alluded earlier. If we have a right support, then we will.
The support system is very important.
And at home, then we're hoping that the life in terms of diabetes, they are living with diabetes, will be managed and controlled. We're not only talking about family; it's really important as well. If it's the students, if you've been what type of support they receive from schools.
Yes.
Not only from schools, but with the different environment where they live in, been engaging or they associated themselves. Like if a children been a part of a sports program, sports activities, so they need a type of support
All
from
of this
them.
is very important.
So talking about a family history of diabetes is increase the risk by lifestyle and factors plays a significant role. While agency may predispose someone, unhealthy habits often trigger the disease. So talking about on that, it's really important for families, their loved ones, to come together and share about the ideas. So even though it's a small organization, what we do, we trying to reach out, we work along with the media organizations, trying to educate our communities about these conditions, what they need to know and they need to understand.
Marau, I mentioned earlier that we all have, met someone or have a family member or friend who's gone through diabetes or who has fought diabetes or still fighting, or we've lost them, because of diabetes. And this is very personal too for me, because I have someone very close to me with diabetes, and it's very alarming, and you kind of don't know what to do and how to provide that support. I haven't really asked my friend this question, but maybe you would, with your experience, what are they really facing?
Just to respond to your questions, one of the biggest challenges with us, if we do understand about our culture, our beliefs, those are the important role for us, especially our Itoke. But one of the biggest challenges with us, not only talking about these conditions, but other conditions like medical conditions, one of the biggest challenges is a stigma.
Okay.
So
there's
still
a big stigma around
stigmas are still around in our communities, not only about communities, even at the workforce as well. So talking about people living to have diabetes, advocacy is really quite important role on this area. Talking about stigma, another biggest challenge for people living with diabetes is acceptance.
Accepting that they have diabetes.
So that's why when we conduct our health screening program out in the community, so before we conduct health screening, the most important thing is trying to educate them to need to understand. If they come forward, if they are coming forward and being detected to have high blood glucose or high sugar, in a way that's they are readily available to come and share with their stories. Some, the biggest challenge with us, the same time when they know they're high, their blood glucose, and the second time they will come back when they have complications, because they still have the stigma and they have yet to accept they have diabetes. So that's what we encourage our communities. They have to reach out to us, not to just take their problems to somewhere. And for give you an example, like for those people living with diabetes who have foot ulcer, or in a way who have a wound in their feet, they need to come forward to us for treatment, rather than they have to go, for example, our rural communities, they prefer to go to have herbal remedies. So at this, in the end, nothing as such can be cured, so they're reaching back to the hospital. So to us, we determine that's a late presentation. So that's what we encourage our communities. They need to reach out to us so they can get the support from us in order to prevent from amputation and other complications of diabetes.
Well, just to wrap things up, I think you've just mentioned it now, the importance of community. I just noticed on your shirt, you have the Ministry of Health and other important organizations that play a strong role. Is there anything you wanted to mention around that with the support of community?
As a charitable organization, we do rely on grant funding or funding from our donors, or either local or donors agency international. So we, to sustain our program, our initiative, been working along with the communities. Multi-sectoral approach is really important to us. Coordinations with our partners.
I'm so happy to hear that word, multi-sectoral approach.
So that's one of the biggest strengths for the organization, talking about where we reach out, where we have a support from the ministry, even from different government agencies, talking about other NGOs, CSOs who've been partner, but trying to, not to only talking about what the objective of the organization, but also cover the areas in terms of mental health, other areas in terms of nutrition, physical activities, and etc. So talking. But we still need encouraging government, in terms of some of the recommendation and the considerations what we put forward in terms of taxation. So that's one of the role of the organization, is to work with government, mainly with the Ministry of Finance, in terms of asking government. We usually see these SSB products, sweet and sugar beverage product like fizzy drinks, and that contains sugar.
Trying to fight for these.
Yes, whatever taxes has been going back to government in terms of for the whatever they going back to government, what we asking government if they either or to reinvest back to those
reinvest back into
for those dedicated organizations like
that are
this.
doing
So
this
we
work.
gave them some submissions last year, but unfortunately nothing, no positive response on that. We're hoping
Keep
with that,
fighting.
keep fighting with this. Yeah, one of the recommendation we made to Minister of Finance is that not only to reinvest but subsidize the cost
Right.
of NCD consumables.
Great strategy. Yeah.
So that's something that make these consumables readily available to our general community, whoever
That's
needs
so
tests,
good to hear.
so they can utilize. But cost is one of the biggest challenges for our
Yes.
people living with diabetes, because diabetes, they need to monitor, checking their blood glucose from morning, midday, and the afternoon.
Wow.
So that's just a portion. Another thing for people living with diabetes, the type 1, or people who use insulin medication, they need to check frequently.
Right.
So in order their sugar to better control, they need to monitor their blood glucose.
It's important,
So it's really important. So we're asking government, why don't you invest those whatever have been taxes for the exercise tax back,
Yes.
for subsidize the cost. We also are raising in terms of to establish a unit with the Ministry of Health and Medical Services, to have a dedicated health promotion unit.
Fantastic.
With the Ministry of Health. So this unit will be mainly focused to reinvest these taxes into sports events. Like one of the biggest challenges the organization is trying to fight for, we can see in Coca-Cola coming up. So who is the main sponsor? So I'm not to say talking about things that but with something we're trying to promote healthy living on this area. So we can, if you have the unit with the Ministry of Health, this is something to say to promote health and for school program, and also banning unhealthy product advertisements, so it can assist educating our communities as well on this. I think about that's based on the essential diabetes consumable like insulin, the syringe. Even government nowadays only provide the medications, but the syringe, our clients, people living with diabetes using insulin, they have to look for that. So it's due to the cost. Some who can't even take in to buy that. So it's quite a challenge.
It's important to know who's doing what too.
Yes,
and
yes.
I think you really covered a lot of that, and so that was really good to hear. Well, there's so much still to talk about with Your Health Matters, and thank you so much, Marau, for making the time to be here. And I know that they can find you on social media, and I'm sure you're able to look them up and visit their organization if you want to hear more about what they do. Thank you so much for coming on the show tonight, and that's it. I just wanted to leave you with something really cool and something fun. It says, stay strong, live sweet, but not too sweet. That's it from Your Health Matters.
This program is brought to you by the Ministry of Health and Medical Services, shaping Fiji's health.